Lots of questions. We have a viewer question from Rosie. Let's take it. How long after getting COVID should you wait before getting the vaccine? So, doctor, your response?
So, Rosie, there used to be the recommendation that you should wait for 90 days, but that recommendation is not in force anymore. So, after you recover completely, have no more symptoms, you're free to get the vaccine. And you should get the vaccine even though you've had COVID, because the protection in your blood is much greater after the vaccine than it is after the natural infection. And the more protection you have, the longer the protection will last. So get that vaccine.
I am so glad you answered that because I hear from so many people, I had COVID, Olga, I don't need the vaccine.
But you do, for just the reason that I said. And also with those variants out, the more protection you have in the bloodstream, the more likely it is that you can take care of and protect yourself against those variants. So there are two good reasons, even though you've had COVID, to get the vaccine.
Great stuff. Okay, doctor, we have a video question from John. Let's take it.
I've been vaccinated and I was wondering, does my reaction to the vaccine indicate anything about my level of immunity to COVID? For example, if I had a bad reaction, does that mean I'm more immune than if I have no reaction?
Doctor, I'm so glad John is asking that. That's a great question because I had a terrible reaction.
Well, I'm sorry about your reaction. I'm sorry about John's. Young people have more reactions than do older people. But as we know, the data show us that this vaccine protects older people just as well as younger people. It just means that your immune system, when you have more of a reaction, reacts more briskly. But the ultimate protection does not relate to the amount of reaction that you had. This vaccine works very well across the age spectrum. Now, starting at age 12, all the way up to however old you are.
And I'm really grateful for what you said about young people don't have so much of a reaction, and some people do as well. I'm obviously not young. It was the second dose, doctor, that really hit me for like 24 hours, not the first one. I've heard that from a lot of people as well. Why is that?
Well, Olga, your immune system is primed by the first dose, and it's wakened up to COVID. And the second time it sees the COVID vaccine, it responds more vigorously. And we think that that's what accounts for somewhat more reactions after the second dose than the first. But those side effects, as you can probably testify, go away in 1, 2, at the most 3 days, and then you're fine and you're protected.
Absolutely. And it's so worth it. Like I tell everyone who hasn't gotten it, get the vaccine, be safe, and it's peace of mind. This one, doctor, I love. The Centers for Disease Control and Prevention say people who are vaccinated against COVID-19 can safely go without masks indoors and outdoors. We just got the news. So there are some exceptions, I believe, doctor, correct me if I'm wrong, but maybe airplanes and buses. Do you think it's still a good idea to do this considering we haven't reached herd immunity? Take it away.
We've been waiting for some time. We get all these questions from people who've been vaccinated. So, doc, what can I do now that I'm vaccinated and I finished my vaccine series that I couldn't do before? And we've been telling them not much. Keep wearing your mask, stay socially distant. Now, the CDC has got enough confidence that this vaccine is really working very well in the clinical trials. Cases are going down. And now the CDC has said, I think we can take this next step so that if you've been vaccinated, you can not only take your mask off out of doors, you can take it off indoors. And as you say, Olga, there are a few exceptions, not in huge crowds if they're indoors, and also not in public transportation and when you come to medical facilities. Let me add one other thing, if I may. There are people who are immunocompromised who live among us. They come in all kinds of forms, people who are receiving cancer chemotherapy or immunosuppressive drugs. we know that they don't respond optimally to the vaccine. So what should they do when they're indoors? For the most part, we're suggesting that they take it easy. Maybe they should take the belt and the suspenders approach. Get vaccinated and wear your mask, because the vaccine probably didn't work optimally in you, provided only partial protection. But for the rest of us, I think that taking off the mask indoors is, in most circumstances, something we can do and be calm about it.
Now, let me piggyback on that, doctor, if I may, and I'm just going to use me as an example. This morning, I went to the supermarket, and I would have to tell you that possibly 3 out of 10 were not using masks, and the other 7 were. So obviously, it's a choice right now where some people just feel some hesitancy, if you will.
There isn't any doubt. There are still many people who are vaccinated, are not immunocompromised, but they've said, we're going to go gently. We're still going to wear the mask for a little bit longer. You're not obliged to take off your mask. That's a matter of personal choice. And Olga, the other issue that comes up is, well, I'm vaccinated. I go to the supermarket and I see unvaccinated people around me. How do I know that they've really been vaccinated because they're walking around without their masks? So we have to trust our fellow citizens. And if you're a little uneasy about that, and some people are, that's okay. Wear your mask and you'll be more content.
That's a great point, doctor. Do you think the fact that now in some areas people can be without masks if they have been vaccinated, do you think the more people see this, the more it'll stimulate people to get vaccinated so they don't have to wear the mask? Because I don't really think many people like it.
Well, I'm a healthcare provider. I wear masks all the time. I can't see what the big deal is, but I know it's out there and people don't like to wear them. But that aside, I think that I hope certainly that this kind of reward for getting vaccinated will help some of the hesitant become vaccinated. And I think this will happen probably in a family and neighborhood context where people will say, Charlie, why don't you get vaccinated and then you can join the rest of us and take your mask off and we'll all be more relaxed. So I hope that family members persuade family members to become vaccinated along with neighbors and friends. We need to vaccinate many, many more people here in the United States to keep the case count going down and staying down. And there are parts of the country where vaccination rates continue to be, I'm afraid, quite low. So we still have a long way to go. We have plenty of vaccine. Come in, roll up your sleeve. It's there waiting for you.